So good afternoon or good morning to everybody. My name is Holly Salazar. I am CEO of the College for Behavioral Health Leadership, and I want to welcome you here today to this important leadership conversation held in partnership with Just Health Collective called Courageous Leadership, Stepping Away from Power and Privilege to Build Community Trust. Now, as folks are joining, just a couple of housekeeping items I'm going to run through today. This will be an interactive discussion with opportunities to participate throughout. So I do encourage you to turn your video on. We'd love to see your smiling faces. Everybody will be on mute during the webinar, but please unmute yourself if you're called upon to speak or if you are asked to ask your question live. And we will get to as many questions as possible, but we might not have time to get to them all. So please share your comments and questions through chat, and we'll be tracking all of that as well. If you do have any technical difficulties, message me privately in chat and I'll do my best to resolve during the presentation. We will be recording this presentation and it will be available within 24 hours, and I'll send you an email when that's ready to go. And then you will receive a survey after the webinar, and I would be very grateful if you would complete the survey and provide your feedback so that we can continuously improve our events for future. So our time today will be engaging and interactive. We're going to kick off our session in a few minutes in breakout groups to give you an opportunity to meet your colleagues and to begin thinking about the role of leaders in a liberated healthcare system. I do want to note that the breakout room discussions will not be recorded. Immediately following will be a moderated conversation with our panelists, who you will meet momentarily, and we will end with your comments, questions, and responses from our panelists. So without further ado, I am pleased to introduce our panel today. We have first off, Duane Reynolds, who is the founder and CEO of Just Health Collective, with more than 20 years experience as a healthcare executive and thought leader in the belonging space. We also have Jeff Ring, who is a health psychologist, leadership coach, and health justice advocate, whose work is focused on health equity and justice and culturally responsive and respectful care. And last but not least, we have Krista Stepney, who is the Chief Operating Officer for Just Health Collective, and who has served in a variety of roles leading the design, development, and delivery of cross-functional solutions with a focus on improving belonging and health equity. And I'm pleased to introduce Krista now as our moderator today. So Krista, I'm going to go ahead and turn this over to you.
Thank you, Holly, and we're really excited to be partnering today. We're super excited about the conversation that we're going to have, but before we jump into the meat of today's conversation, we really wanted to kick things off with some small group discussions. So in a few minutes, Holly will actually break us up into Zoom rooms with about 3 to 4 people. As she's already stated, those sessions won't be recorded, but we are asking you and inviting you to turn your video on during those sessions, since it'll be a much smaller audience, and to really give us an opportunity to connect virtually. But before we start, we want to also offer a moment for self-reflection to get us in the mindset of some of the questions that we're going to be walking through in the breakout group discussion. So Holly, if you'll go to the next slide. Okay. So we're going to take about 2 minutes, and if you would just, whether you want to scribble this down on a piece of paper that you've got beside you, or actually type this somewhere in your computer, we're not asking you to share it in the chat, but just really a self-reflection around this question here. What is your definition of a liberated healthcare system? Your definition of a liberated healthcare system. So we'll take about 2 minutes for that. As you think about that question, another one that we want to add into that, if you go to the next slide, Holly, is what are the major barriers to that liberated healthcare system? And then the third question, as you're taking this 2-minute reflection on the next slide, is what gifts and talents do you bring to this work? Okay. As you're wrapping up that self-reflection, want to give some instructions before we move to the breakout sessions. Remember, we are inviting you to turn on your cameras. We want everyone to start out with introductions, and we'll save about 5 minutes of time to share some of the answers that you wrote down to the prompts of those 3 questions. For those of you that might be new to Zoom breakout sessions, just a couple of housekeeping and instructions. You're going to get a prompt that's going to invite you to a breakout session. You simply just need to click the button that says join. You will be able to just kind of self-nominate a person to start off with introductions and go round robin. And then we're just recommending that you take about 60 to 90 seconds each to share your responses to the 3 prompts that we have here. Once those 5 minutes are over, Holly will bring us all back into this major session here, and we'll be able to continue our discussion from there. All right, Holly, you can go ahead and put us in the breakout rooms. Yes, welcome back. Well, hopefully that was very engaging and just a great start to being able to shake off any cobwebs from this discussion that we're about to have. I know that I certainly enjoyed the breakout session. I'm not going to brag, but we might have had the best breakout group. But as we all come back together and just really get ready to start kicking off this next session, if we could just really utilize the chat to answer the question around what were you left wondering after your small group discussion? We'd love to get some feedback in the chat about what were you left wondering as you think about those 3 questions and the feedback that you heard from your respective colleagues.
So I'll go. Hi, everybody. I'm Dana. I'm from the city of Philadelphia, and I met with Rick and Steven, and we had a great discussion around some of the work that we're doing across the United States, essentially. And what I was left wondering, and Holly knows this is how my mind is always thinking, hearing about all this great work and really exciting connections, is what's happening underneath the surface to make all of those wheels turn, and what is happening to drive all of the work forward, whether it's in Philadelphia, Ohio, or California. What do the teams look like? Mm-hmm. What are the supports and resources in place? I'd love to just keep unwrapping the onion because it was really cool to hear about. Thanks.
Dana, thank you for sharing. And as you're sharing, and I'm seeing some of the responses in the chat, I hope Jeff and Duane, you all are really getting geared up, because these are the questions and the comments that are really going to spur our conversation for the moderated portion here. Well, wonderful. Well, I know that we're not sharing our screen, and we're doing that intentionally so that we can kick off the Q&A section with our 2 panelists that Holly introduced at the beginning, Duane Reynolds and Jeff Ring. So as we move into the discussion, I'm going to give both of them a series of questions. But if you've got questions in the chat, we will have a Q&A section, but please feel free to put those questions in there, and Holly and I will be keeping an eye on those so that we can kind of interject some of those follow-up questions with what we've have prepared here today. All right, well, Duane and Jeff, excited to engage in this conversation with both of you. Let's actually start with the question that we posed to the breakout rooms. And the first one being, what is a liberated healthcare system? And what is the role of leaders in a liberated system? Duane, we'll start with you.
Well, thank you. Thanks everyone for attending this session today. Very excited to be speaking with you all. And my definition of a liberated healthcare system is a system that is free of bias, free of discrimination, and it allows everyone the opportunity to achieve optimal health. And by doing so, it results in health equity and the elimination of healthcare disparities.
Thank you, Duane. I appreciate that, really highlighting the elimination of the bias and being able to mitigate against the disparities. Jeff, your response?
Yeah, it's an important question. I think a liberated health system is one that is freed of the shackles and chains of the terrible legacy and history of racism in our nation. And I think about Pamela Rush, African-American woman who lived in a very, very deep poverty in one of the poorest areas in Alabama. She was part of the group that went to speak to Congress about poverty and health, and then a couple months ago passed away from COVID because of her skin color, because of her poverty, because of how racism unfolds in Alabama and in so many corners of our nation. This is the consequence of a health system that is deeply poisoned by the legacy of oppression.
And Jeff and Duane, as I think about the next question, it actually kind of ties into some of the comments that we have in the chat around how do we move this work forward? How do we get to that reality of that liberated system? And I think about even Dana's comment about what are the underpinnings? Like, how do you continue the momentum? And so this next question is really about leadership and the role that leaders play in this. So as leaders, how do we begin thinking more broadly about what it means to have the voice and perspective of underrepresented populations in the leadership ranks? How does this, translate to collaborative work in the community? So Jeff, let's start with you this time.
So I'm speaking from a perspective of a white cisgendered man. And I'm thinking about the work of Kamara Jones, family physician, Black scholar and healer, was the past president of the American Public Health Association, and her presidential initiative was Undoing Racism. She has very wise advice for us as leaders. She says, first, we must name racism when we see it. We must have the strength and courage of voice to call it out. Second, we must lean in and really deeply understand how racism is at work in this organization, in these relationships, in this system of care delivery. And then part three is that we must confront. We must confront how we are working together, and we must look at our policies. We must look at our procedures. We must look at centering. We must look at voice. We must look at having the really difficult conversations. So not easy to do, not comfortable to do, but essential. Mm-hmm. And I think for me as a white man and for my other white colleagues in leadership, we have a lot of important work we need to do to be able to get to that place. We have to have some very deep and powerful conversations with ourselves and with each other about how growing up in this world where racism is in the air like smog and it completely infiltrates how we see and live and make money and live off of that money, we need to have some important conversations with ourselves. And then we need to take these conversations to one another. And we need to think about power, privilege, place, space, and what it means to step up in a way that if you want to get to them, you have to come through me first. I think that's another precious and important aspect of leadership.
Thank you, Jeff. Duane, your thoughts?
Very good question. And I think, leadership is the key to solving this issue, but not necessarily in the way that we typically think of leadership. I see leadership from this perspective being about servant leadership and understanding when to get out of the way, how to create the space for underrepresented, marginalized communities and leaders within those communities to actually guide the conversation, to be at the table to help make decisions, strategic decisions, operational decisions that ultimately impact the community in which your organization is serving. So a lot of it is about self-awareness first and understanding your individual contributions to a larger system at play, a system that reflects systemic racism, and understanding how you as an individual feel and believe and have been a part of that system whether intentional or not, we are all a part of that system. Understanding then how you translate your growth, your learning into your leadership skill set and your responsibilities to your organization and the community that your organization serves. And then taking it to the next level and getting outside of your organization and realizing that in order to truly create a liberated healthcare system, we have to partner. We have to understand that policies are at play at both federal, state, and local levels, which ultimately impact our ability to align the system in a way that ultimately leads to health equity, leads to elimination of healthcare disparities. It's a huge undertaking, but ultimately, I think it starts with a reflection and understanding of the role that you play as a servant leader, particularly in healthcare roles in our industry.
Mm-hmm. And, you know, with both of you bringing up the component of really addressing and calling out racism, before we move into this next question, I'm actually going to invite Holly to bring up a Mentimeter question that we can get some feedback from the audience. And really the question is centered around, how do we define what does anti-racist mean to you? Or what does anti-racism mean to you? So if you look in now at the screen, you should see that Holly has shared menti.com. And if you actually use this on your phone or on your computer, you'll just go to www.menti.com. And I'll put this in the chat as well. And you're going to enter in that code. As you share your feedback, we'll start to see some of those answers pop up. And Duane and Jeff, I want you to be looking at these responses as we move into the next question, which I'll bring up in a minute.
And there's also a direct link in chat. You can go right to access the same.
Thank you, Holly. Let's give it another 30 seconds for people to share some feedback here on this question. All right, Holly, thank you. I think that's good. And as that word cloud is coming up, Duane and Jeff, the next question is really tied to anti-racism. And the question is, and it's a couple parts, so just bear with me here, but what does it mean to become anti-racist? And how do we measure this? How do we measure that movement? How does that translate to leadership? And as you think about that journey to becoming an anti-racist, what does it mean both personally for that leader and within an organization to be a self-reflective leader? What are some of the roadblocks that you might encounter on that type of journey? What does it mean to show up differently within your community and your organization? Do I need to repeat that, or do you think you have a good grasp of the question?
I think we have at least I have a pretty good grasp, but certainly I'll ask for follow-up if I miss.
Okay.
So I believe I'm seeing the answers here, and the one that is obviously sticking out is action. And I believe that is exactly right. Anti-racism is about the practice of identifying, challenging, changing values, structures, and behaviors that ultimately perpetuate systemic racism. And in order to do that, I think that we have to understand that racism in and of itself is an active process. And so anti-racism has to be the antidote to that active process. It's present in racism, is present in policies, it's present in procedures, but it's also in institutions, and not just at an individual or behavioral level. And I apologize, I have my dog moving behind me in the background. So it really means we've got to be working towards eradicating the power imbalances that have been created in our society that are based off of race. And so in order to do this, we have to be actively involved in the change process in order to get towards being non-racist.
Mm-hmm. I think, Duane, just the last piece that I'd love to get some feedback on before we shift to Jeff is, what are some of the roadblocks, or what does it look like for a leader to actually be reflective and then, really present differently within their organization and even in their personal groups outside of work?
Yeah. Well, in the context of the work that we do at Just Health Collective, some of the roadblocks that we've seen first are they're two-sided. First, for white people, I have seen this knee-jerk reaction to want to be defensive when talking about racism and or feelings of guilt when talking about racism and sort of recentering conversation. So I think that is a natural reaction, but it's a reaction that actually recenters the conversation on the white person as opposed to centering the conversation on, the underserved, underrepresented racial groups. So I think that is one challenge. The other challenge for people of color is wanting to move very quickly to change the situation, which is understandable because we don't want to sit in it any longer. However, that necessity, desire to move quickly through it can potentially alienate the very people that we're trying to bring along and change their minds. And so I think there is a delicate nuance and balance that we have to play in that process. Today, we have a lot of cancel culture happening. And while I believe there are certain instances where that may be appropriate, I don't think it is the first reaction that should happen. I think we have to, just as we want others to understand, believe our lived experiences, we have to start from the place that they are to understand, believe, and then if we so choose, because it is not our complete responsibility as people of color, but if we so choose, to educate, to share our lived experience, to develop allies. And the process of developing those allies really is about helping them understand who you are, what your experiences have been, how they have shaped your life, your lens, your approach, so that those allies can really take on the responsibility of educating other white people about the process of becoming anti-racist.
Thank you, Duane. Jeff, do you need me to repeat the questions, or are you pretty good?
I don't need you to repeat the questions, but we need about 6 months to talk together. That's what I'll.
At least.
Duane, I just so resonate to what you said about become actively involved in the process of change. That is no easy task, particularly for white folks, where racism just works in a way that it's a system built to keep things as they are. And so somebody wrote in the word cloud, divisive. I was wondering about that word. Like, were you writing that racism is divisive, which it certainly is, or were you writing that anti-racism is divisive, which
that was me. I wrote divisive. I can comment in the chat why I chose that word. I was worried about how it might be understood. So I'll comment in the chat.
Yes, say a word or two right now.
The reason I said it's divisive is because there are so many people who refuse to acknowledge that it needs to be attended to and worked on and addressed. And so it somehow becomes a divisive thing. It shouldn't be, of course. It's horrific that it is, but there are people who, like, I think, Duane, you said that, that so many white people become defensive at the start of the conversation, or say things like, I don't see color. You know, it's like, that's what I meant by divisive. It should not be, but there are people who, it's an argument.
No, that's beautiful, Diane. Thank you. So I'm going to just draw again on another of the beautiful images from Kamara Jones, Dr. Jones. She says, think about racism as if we're all on a, what's the right word? Like we're on a conveyor belt and we're all going in a certain direction. And that direction is the way things always have been, the direction of unequal power and unequal access and poor outcomes, all the things that racism breeds. And then imagine that you don't want to go in that direction anymore, that you want to go in the other direction in a new way, that you find the energy and the courage and the strength and the vision to turn around and to walk against the tide, we might say. Well, what's going to happen? You're going to get hit. You're going to get hit on your shoulders and pushed and worse, right? Because you're going against the tide. And in that way, anti-racism is divisive. So how does one prepare to be able to take that journey against the grain, expressing a new voice for justice and humanity? Well, it takes certainly, I think, a lot of personal work about the things you were discussing, Duane. Like, I have to wrangle with my guilt. I have to understand my part in this. I have to recognize that I wasn't part of slavery historically, but in the words of Isabel Wilkerson, I have inherited a house that is broken and I better fix the plumbing, actively engaged. And so I know this may be controversial, but I think leaders, we need to have some conversations, especially white folks, amongst ourselves in some spaces where we can talk about all that stuff, about guilt and power and privilege and sharing and centering and creating space. I think that racism does a really good job at not helping us see, understand, or do those things very well. And that we probably need some skill building in a kind of a anti-racism gymnasium, you might say.
Thank you, Jeff. And I'm going to break protocol here a little bit. I was going to wait and have all the questions that were entered in the chat at the end, but this one's too rich and so timely with the discussion. Tim, thank you for your question in the chat. Duane and Jeff, in case you can't see it, the question is, what would you say to organizations, and let's just say leaders as well, leaders of these organizations that don't want to use that language to become anti-racist from a legal stance of admitting to being a racist organization?
I love this question. It's very timely. I was on LinkedIn and a health equity colleague of mine recently submitted an article that had the title "Racism" in it to JAMA, and JAMA sent it back and wanted to take the word racism out. So first things first, we have to name it in order to fix it. Skirting around it just further pushes it under the rug. And I think we have all seen the implications of that last year. I think based off of organizational safety, yes, there is some understanding of certain language that can lead to risk. But here is the counter to that. We all know that racism exists inside of organizations. And just like the quality movement, the patient safety movement that happened in healthcare, we had to admit that we were causing harm. This really is no different in that it has implications for health outcomes. It's estimated that some 83,000 Black and brown people die annually from health disparities. So the real legal risk is in continuing to perpetuate that system. And once we move to a more transparent, data-rich environment that actually now holds healthcare organizations accountable for those disparities, the real risk will come in not having done anything to change that stance. And we are on the horizon of that based off of a few things that I see happening. Number one, there's now a dedicated person leading health equity, a task force within the Biden administration. Number two, laws are beginning to be proposed in different states. For instance, California is proposing a law around unconscious bias training and around tracking and intervening on health disparities. CMS, Center for Medicaid and Medicare, Center for Medicaid and Medicaid Services, their Office of Minority Health actually has health disparities within Medicare data at a regional level. If they have it at a regional level, they also have it at a hospital level. And so at some juncture, we will get to a place where this data becomes transparent. And I would prefer, if I were a leader of a healthcare organization, to be thinking about what's around the corner versus worrying about the use of the word racism.
Thank you. Jeff, anything that you'd like to add?
That was really so beautifully stated, Duane. There are many, I like motivational interviewing and readiness for change, and I realize not everybody's at the same place about certain words. At some point, we will have to get to that place and have the whole conversation about racism and oppression. But there are lots of pathways, and Duane just provided one beautiful one, which is about quality and safety. The other is a conversation about what is our mission, our true mission. And then there are like tried and true roadmaps, like the federal class standards, CLAS, right? Standards for culturally and linguistically appropriate services. How important is it to pull that out and make copies and send it around and to have a conversation with ourselves about how are we doing on each of these? Did we even really know they existed? and how are we doing? You can, at a board, at your next staff meeting, print up the class standards and go through and give your organization a letter grade from A to F. And for any of those areas where you got less than a B, you should start to think about what would be the action steps that are going to raise your grade. So we can have the conversation about equity and justice and not necessarily have to use the word racism at the beginning. But in the class standards, there is a mandate that we look at our data and outcomes sort of stratified by race, ethnicity, and gender and sexual orientation. Like, we need to do that. And so what a beautiful, lovely, federally sanctioned way, mandated way to lean into those conversations.
Yeah. And the conversations,
go ahead, Duane.
I was going to say the conversations are more broad than just race, right? But we have a distinct opportunity to begin reconciliation of something that has plagued our country for over 400 years. So I don't think we waste this opportunity to move into that space. But if you feel like your organization needs to take a less direct path, then you start talking about the disparities and unconscious bias that are really relevant to your population. For instance, if you're in a rural hospital or a rural healthcare organization of some sort, understanding that people in rural communities have shorter lifespans than those in urban centers, and talking about health inequity from that perspective and why, access issues, perhaps insurance issues. I think you can start where your population is, right? And the challenges that they face. But ultimately, don't leave out the conversation of racism. We've done that for far too long.
Mm-hmm. And Duane, I think that's the perfect segue into what, this next question is all about. And Catherine in the chat added such a great comment here. Really, when we talk about that movement, that action, that stepping forward, that stems from a place of courage. And so the comment that Catherine put in that I thought was a perfect segue is, one of the things I learned is to move from being an ally to an accomplice in promoting change. moving from being an ally and supporting anti-racism to actually speaking up, educating people, and taking specific actions. Well, Catherine, not to speak for you, but I'm sure that that probably took a level of courage to step into that place. So as we move into the next question, we're going to ask you to jump back into menti.com. And this question is, what does courage mean to you? And again, Duane and Jeff, I invite you to look at the comments that are coming up because this is going to tie into our last question before we open it up to Q&A. So interested to hear from the group. What does courage mean to you? And I think, Holly, you're putting another link to this Menti as well in the chat, correct?
Yes, it should be there now.
Thank you. And Duane and Jeff, as this is coming up, I'll give you a preview of the question so that you can prepare your answers. How do we help people find the courage to step away from power and use privilege to advance the cause? How do we help people find the courage to step away from power and use privilege to advance the cause? Take that into consideration as you see the word cloud that's forming from the group on what courage means to them. We'll give it about 30 more seconds for the group responses before we shift back to Jeff and Duane to answer that question. All righty. Thank you, Holly. We can close the voting or close the response. And Jeff, let's start with you in answering the question on how do people find the courage to step away from power and use privilege to advance the cause?
This is really a very beautiful and inspiring word cloud. I just want to say, by my looking at this, it seems pretty cognitive to me. And I just want to invite in this idea of embodying courage. Where does courage live within you? What fosters and grows the courage behind action, along with courageous thought? I feel like courage is built through trust, and trust is built through narrative, and narrative is the foundation of true, active, open-hearted listening. I think racism doesn't want white folks to hear and understand, much less feel, the experience of Black people and how slavery, racism, mass incarceration, and poverty and on impact people's lives and families. And that I need to build and rebuild my courage to feel, to reclaim the emotions around the realities of the world, the realities of others. So if we all said sentences 3 or 4 times a day that began with, "What I hear you saying is," like, how different would the world be? How much more connected? How much more proximate could we be, in the words of Brian Stevenson? The courage to lean in, the courage to be close. I saw this photography art installation where very different people just were pulled off the street from each other and asked to hug pre-COVID, and the photographer took a picture, and the stories they told of a different kind of closeness and intimacy that arose very quickly is another source, I think, of hope and possibility. Proximity, courage, connection, undoing oppressive power is it's just this close.
Thank you, Jeff. Duane, your feedback?
Jeff, I second the sentiments that you've communicated to us. When I think about this, and I think about my own journey to want to be in this space of work, I always think about the why. Why would this matter to any of us? When we work with our clients, we generally talk about what this means in the context of people that you love. What does it mean for your children, your grandchildren, the future generations that will inherit this broken system? And does it feel appropriate to either be a part of the change or to maintain the status quo? And what side of history do you want to be a part of? Looking in the face of those loved ones, what would you tell them about what you did to either help move change forward or to do as what we've really always done in this country, which is pretend like it didn't exist? And we didn't step outside of ourselves to actually understand the perspective of others. And to me, that's not called anti-racism. It's called being human and understanding humanity. And that there's something bigger than us at play. But we, in our individual space, and we as leaders can actually make a difference.
Mm-hmm.
And we have to ultimately decide whether or not we care enough about humanity to step into that discomfort and be a part of the change.
Mm-hmm. Jeff and Duane, it's not enough time to get through this important topic. But I do want to be respectful of our time. And there is a question that was in the chat that I want to open up for Q&A. And this could be a two-part question for also our participants. We invite you to share your response to this question in the chat. But for Duane and Jeff, if you'll share out loud a question that Julie asked, what are we willing to give up and let go of in order to truly change things in our communities and this country? Great question, Julie. And we invite everyone that's participating to share their feedback in the chat. And Duane and Jeff, we're interested in maybe just a 30-second response from both of you on that as well.
So I'll answer it through the lens of reparations. Duane was just describing human reparations and how we build, rebuild connection with one another in a way that is power equal. And it's worth reminding one another that question about how much do I really need? How much do I really need? Whether it's power and or money and or access and or a new title and or filling up the space in a conversation. How much are we willing to give up? That's an important question. That's a fair question. And I think each of us is going to need to answer that, particularly white folks with an abundance of power, privilege, and resource.
Yeah. From my perspective, and this has been a perception of mine, is willing to give up the moral authority of being right. What I mean by that is, in my heart of hearts, I know that racism is wrong. And I know that the things that I'm fighting for day in and day out through my work, I believe those to be right. But on the same token, not everybody has the same frame of reference. And only when I meet the person where they are, can I perhaps help them along their journey. And that's really been quite frankly, what my life has been about. But as I've stepped further and further into the social justice and equity work, I also understand that I've been quick to pass judgment and quick to cancel. And I don't want to be that. I don't want to do that, because there's something more to this than me just being right in a particular instance.
Mm-hmm. Mm-hmm. Wow, I think both of those responses resonate well with me as I just even think about that question myself on what am I willing to give up and do differently. And as we actually wrap up the session, Holly, I'd love if you could share the screen again, because, you know, Richard, I want to thank you for your transparency in the question, or your response, excuse me, that you shared here. And really just having that important thought process and insight that you're sharing, and what some of the work is that you're doing. And I think this bodes well into this last question, where we'd really like to get your feedback here in the chat. What do you intend to do new and differently based on our conversation today? If you'll just share that information in the chat. Mm-hmm. And as people are sharing their responses, Holly, anything else that you would like to add? I know we're close to time, so just want to give you a chance to have any closing comments.
Thank you. As I come off mute here today, and I encourage you, everybody, to continue thinking about this question, what we intend, I know I'm going to, what we intend to do new and different based on our conversation today. I think just in the interest of time, I want to thank everybody for participating in this important conversation. It's given me a lot to think about, and I'm actually looking forward to going back and reviewing the recording of this, because I think there's so much that we can learn from these conversations. I do encourage you to reach out if you have questions or continued thoughts or needs as leaders. We certainly, both on behalf of College for Behavioral Health Leadership and I'm Just Health Collective, want to be here to support all of you and all of us as leaders trying to do this work. And I would welcome your feedback on future topics that we might bring forward and have conversations about, so that we can continue to advance this cause and take action. And I'm dropping a link in chat right now, and I'll send this out to everybody to a survey where you can provide us some of that feedback. You're also welcome to reach out to either Duane or I directly with any comments or feedback. And again, I want to thank Krista for her fantastic work today moderating. I want to thank Jeff and Duane for their important insight and the conversation that they held. And I want to thank all of you for participating in this, and for the work that you are doing and will continue to do. I hope you have a great day. Jeff, Duane, any final closing thoughts?
I just want to say thank you to Jeff, thank you to Krista and to Holly for helping to organize this event. It's been one of the more poignant and insightful conversations that I've had around this, so thank you.
And Duane, I just echo your gratitude. I feel full of energy. I feel uplifted in our conversation. I feel connected. I feel inspired. And I feel all the more prepared for what awaits.
All right. Well, we will, I'll be on for a couple of additional minutes here if anybody wants to stay and chat, but otherwise have a great rest of your day, and we'll be in touch soon. Thank you.